Welcome back. We're pleased to have in studio Dr. Sam Muslin. We're talking about dental veneers and what you can accomplish with them. The pictures so far have been incredible. The next young gentleman you're going to talk to me about actually had braces, yes?
Yes.
And he got his teeth straight, but just the colorization wasn't right, maybe?
He didn't like the color. He still had a deep overbite.
How old he was?
He was 19.
19 years old. All right, well, let's bring up his before picture and take a look at it. Okay. He's a young, good-looking young kid. Kind of almost a forced bite. It almost reminds me of my daughter when she smiles. They kind of got that fake, you know, like they're forcing themselves to smile.
Well, he knows he doesn't look bad, but he also doesn't look good.
But now he's had braces, so his teeth are straight.
Fairly straight. He has spaces still between his teeth, and the bite did collapse down some.
Okay. And so now tell me what you did for him.
What I did was a facelift for him. And that is I was able to change the shape of his entire face by rebuilding his bite with ceramics.
So you rebuilt his entire bite?
Yes.
Were you able to get rid of the discolorization that came a little from the braces?
Absolutely. We made his teeth look white. We coordinated and balanced all the shapes, all the sizes.
Why, if he had braces, would he need this?
Well, because the braces really didn't work, and he probably didn't wear his retainers, and he may not have been the best patient during when he was 15, 16 years old. So here he is, 19 years old, and he says, there's no way I'm going to wear braces again. So he either stays the way he is, or we do something.
With the braces, can they elongate the tooth like you told me you did here and give him the full smile?
It's a lot more difficult, I think, with braces, but it would be possible. It would just take a lot of years.
Okay, so let's take a look at his after. Oh, that doesn't even look like the same kid.
Well, you'll notice the distance from his nose to his chin has been increased by 1/4 of an inch. So the shape of his face is in much better balance.
Yeah, his chin's a lot longer. I mean, it's elongated. It's not that square. And his smile is much more natural. Maybe it's just he's smiling from ear to ear, but I would too if I had those teeth.
It's wider. We made his smile wider. We balanced the shapes and sizes of his teeth, and if you put the before and after close to each other, side by side, you can see the shape of his face is vastly improved by only getting his bite rebuilt.
And in the before picture, his upper teeth actually come down over his lower teeth.
Yes, he has we call that a deep overbite. His chin is pushed back.
And you can fix that with veneers.
Well, this is the dental facelift. This is taking every phase of dentistry, every technology, jaw joint technology, crowns, bonding, veneers, overlays. It is the coordinated effort of all the dental technologies to produce a final product of the dental facelift.
That's an incredible.
That's beyond veneers, but it's using the veneer technology.
All right, let's take a look at the next gentleman now. This is an older, not older, but older than 19 years old.
Yeah.
This is a good-looking guy. His teeth are a little
dragged in by his wife.
Really?
Dragged in by his wife.
I can see why. She wasn't too excited about kissing him with those teeth.
You are going to get these teeth fixed.
I mean, if you look at his smile, it looks like he's got a chipped or broken tooth on the top. The bottoms are a little small and tiny. They're a little dirty looking.
Implant, he had a missing tooth. We did an implant, root canals, gum work, you name it. Everything was done.
Do you do each individual client start at the minimum you can do and then you build from there depending on what they need? Or do you pretty much one size fits all?
No, each patient and I discuss what their possibilities are, and the patient picks the level of care they want.
All right, well, let's look at his after, because he doesn't, I mean, he looks better. He just looks like he's a much more successful man. He's even got, I want to tell you, and this struck me, he's obviously got more gray hair in the picture on the right, but
yes,
he looks 10 years younger because of his smile and his confidence level than he did before. If we can put both the before and after up together, I mean, he looks more confident. You know, I've talked to you about before that people's teeth are the first thing other people see about them. And
yes,
with that smile, he smiles more.
Oh, yes.
Does it change people's lives?
What it does is it makes many people look like they're grumpy. Men look old and grumpy, and they're not. But they look that way because of their teeth and their bite. When you get your bite reconstructed and you have teeth showing and they're nice and clean and healthy looking, you look happier.
All right, I want to look at the last photo you brought today, because I, at first when you showed it to me, didn't believe you. So we're going to bring her photo up. Now tell me a little bit about her.
Basically, she was planning to go in for a full facelift. She didn't like her lips.
But she again has that little, to me, I call it the forced smile, their uncomfortable smile. I don't know what it is, but they got that little tight lip look. What did you do for this lady? She had no facial plastic surgery work done at all, correct?
No, correct. If you look at the before and after pictures side by side,
Okay.
you'll see the shape of her face before
Let's bring those up right now.
is a little bit short and wide. And so that her face looks wide and
Did
it
you
looks
put
short.
an implant like in her chin?
No, there's no implants, no facial work at all.
I mean,
Basically,
there-
the only thing done was work on her teeth.
And you did
her
that
bite.
all using dental technology?
Dental technology, porcelain veneers, porcelain crowns. Basically, we were able to rebuild her bite and use the porcelain to support her lips better and to make her distance from her chin to her nose longer.
Her smile is much more natural. She looks much, much happier.
She-
I'm almost out of time. I
Okay.
want to ask you, before we go, if there's one thing you wanted everybody to know about veneers, what would it be?
I think that it's the least expensive thing you can do during the course of your lifetime to help you look better, feel better about yourself. I've had patients walk by the mirror and shock themselves in the morning. They're happy. It makes you feel good about yourself, and it makes your appearance look professional.
All right. If somebody has a question, they have a concern, don't know where to get the answer, I'm going to put you on the spot. Can they call you?
Absolutely. They can call me anytime. I'd be glad to help them out, and they can also look at the website to get additional information.
Well, I want to thank you for coming on the show. It's been a pleasure. You've taught me things about veneers that I never would have thought possible. Hopefully, I'll be able to have you back one day.
My pleasure.
You've been watching Medical News Network. I'm Mike Wittgenstein. For future information on this topic or any other, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.